Hi, I am Dr. Zainul Aabideen. I am a pediatric oncologist. I am making this video for patient teacher. Patient teacher is a venture to educate and empower patients and their carers. Today I am talking about infection in children during cancer treatment. First, I will talk about what is infection. By definition, infection means entry of germs. It can be bacteria, virus or fungus into your child body where they multiply and they spread all over the body and it affects body function. Eventually it causes death. In general, infection starts from one part of the body and it can spread to other part of the body. I will show you some pictures so that you can understand different types of infection. Most of the children on cancer treatment can have central venous catheter. It is also called 𝒂𝒂𝒃 or Hickman line. So at the site of 𝒂𝒂𝒃, you can see redness and swelling. It can be a sign of infection. Sometimes children can get viral infection on the skin. It is called herpes zoster infection. You can see from the picture. Sometimes herpes infection can be on the lip, around the mouth. Another infection you should know in children during cancer treatment is chickenpox. Usually in normal children with normal immunity, chickenpox doesn't cause much trouble. It resolves by itself without much treatment. However, in children during cancer treatment, their immunity is low. In that situation, chickenpox can be very serious. Therefore, if your child develops chickenpox or if your child has contact with children with chickenpox or they develop chickenpox within few days of contact, you should contact your doctor immediately. They may start treatment. Infection can be inside the mouth, around the tonsils. They can get infection in the breathing pipe, including lung, which is causing pneumonia. Pneumonia can be bacterial or fungal pneumonia. Children can get infection in the food pipe, presenting as diarrhea. Sometimes they get infection in the ear. Infection can be in the urine and urine pipe. Wherever the infection starts, finally the infection enters into the blood. It's called sepsis. Now you have seen different types of infection. It is important that you should know why infection is very common in children during cancer treatment. Normally, body has immune system, which is a defense against infection, which prevent infection and which fight against infection. During cancer treatment, it can be due to cancer itself or its treatment, which include chemotherapy, which can affect immunity, which can damage the immunity. That is the reason children during cancer treatment, they get more infection and sometimes it can be very serious, leading to death. In addition to this, children with cancer, they don't eat properly, they don't sleep properly, and they are anxious and stressed most of the time. All this can reduce the immunity, which can increase the risk of infection. Another thing you need to know in this context is neutropenia. Before I tell you about neutropenia, you need to know what is neutrophil and its role. Neutrophil is a type of white blood cells, which is very important part of body's defense mechanism. Usually neutrophil prevent and fight against infection, especially against bacteria and fungus. Most of the chemotherapy medicine destroy neutrophil and reduce the production of neutrophil. That condition is called neutropenia. Sometimes it is also called low absolute neutrophil count or low ANC. As I mentioned before, most of the time in children on cancer treatment, their immunity is less. When they get neutropenia, their immunity is even further less. During this time, they are prone to have bacterial infection and infection by fungus, and it can be very serious. Usually, you can see neutropenia in children after about 7 to 10 days of chemotherapy medicine. It usually lasts about 5 to 7 days, and after that it starts increasing. So during this period, children are very prone to have bacterial as well as fungal infection. Now you may need to know, how do you know your child is neutropenic? Usually after giving chemotherapy, doctor will tell you when you should do simple blood test called complete blood count or CBC, which will tell us whether your child is neutropenic or not. Now you know that children on cancer treatment, their immunity is less, and sometimes their immunity is further less, especially after giving chemotherapy medicine. So obviously you may ask, any medicine do we need to give your child during this period to prevent infection? Yes, we can give different types of medicine to prevent infection during this period. In some situation, doctor give you a special injection called G-CSF, which increase the neutrophil count. This increasing neutrophil count will improve ability of your child to fight against infection. Another medicine doctors always give to children on cancer treatment is septrin. It is also called Bactrim. Usually it is given 2 days or 3 days per week. It is always better to ask your doctor whether your child need any of this medication. And moreover, when you get discharged from the hospital, make sure that you have enough Bactrim to take home. Another most important thing you must know is how you recognize infection early in your child, whether the child is in the hospital or at home. The most important thing is fever. If fever is more than 38 degrees centigrade, you need to think about infection. You need to call your doctor. Other thing is, even with or without fever, if your child gets swelling and redness at the site of Portacath or Hickman line, you need to think about line infection. Other thing is, your child can get skin rash, which can be herpes zoster infection or which can be herpes simplex infection. You can also see the rashes of chickenpox like this. There are other signs and symptoms of infection are pain in the ear, headache, diarrhea. They can get pain while passing urine or their urine become red or cloudy. Without any of these symptoms and signs, they can become very unwell suddenly. At that point, you need to think about infection. So obviously, if you suspect or if you are worried about infection in your child during cancer treatment, you should contact your doctor immediately so that doctor can start treatment as early as possible. In addition to recognizing infection early, you should know what are the precautions you can take to prevent infection. The most important is hand washing. You need to know how effectively wash your hand and your child hand and any people who is looking after your child should wash the hand. At least all of them should use hand sanitizer. Other thing you should do is make sure that your child mouth is clean after every meal. Make sure that all the food you give to your child is well cooked, and you should avoid crowd. Always better to avoid going to any place where you think there is people with chicken pox or other viral infection or fever, and you should avoid any children coming to your home who just had a live vaccine like oral polio. It is always good practice to see a dental doctor at the time of diagnosis before your child gets started chemotherapy, so that dental doctor can check teeth of your child. If any potential risk for infection, it can be treated. In conclusion, by listening this video, you must know that infection can be a serious complication in children during cancer treatment, and you can do many things to prevent infection in your child, and you can also observe many things on your child to suspect any infection, so that you can go to the hospital early and get treatment started as early as possible. I think I have covered most important things today. However, if you have any further question, you can contact me through WhatsApp or by email. Thank you very much.